We start our the third category of topics for the day, where we will be covering about mental health and learning disorders. Today, learning disorders are on a rise. In the past, it was 1 in 3 or 3,000 or 4,000 children that we would see, someone diagnosed with autism or ADHD. But today we see 1 in 150 children being diagnosed with, these conditions. Often the answer given is genes are the cause. But has the genes really changed over the last 30, 40 years? We have with us Dr.Praveen Saxena. He will be shedding light on the connection between lifestyle and environmental choices on autism. Over to you, Dr. Saxena.
Yeah, thanks, Rui. And it was a pleasure. I was it was a big learning experience sitting out here. And Alok ji, Shakshat Pranam Aapko. And Lenny, my brother, we have been on this kind of thing, trying to, we met some 20 years back. And we thought, as a conventional, I'm a radiologist, Lenny is a geriatrician. And we tried, what are we actually? And having worked in behind the screen as a radiologist, I was keen. What are we doing basically? We are just putting across a revolving door to the patient, and from here he goes out and he comes back with something. Nothing against any kind of pathies and all that. We were trying our best, try to see that we can reach something. We can always do some quality work and all that. So more focus was on, emphasis was on detoxification. I must tell you, I'm as a radiologist, I got into autism because of my son, this way back in 2000. And as a radiologist, I was not aware what this is term autism was. And now I see this is a big kind of stuff. Yeah, it is a but this was a big learning curve for me. Doing MBBS, after doing radiology, it took me 4 5 years to understand what is autism. I'll just give a brief overview how I can work it out. I'll just share my this particular PPT, and see, I can give you some kind of just idea about what are we into that. And let me start with some examples, because what happens is that people really connect with that. The first example I would like to start with is an 11-year-old boy, was all the time was doing good in his grades and all that. Suddenly becomes हिंदी में बोलते हैं एकदम हटके. So we are all hatke in the sense I'm not. Uh, we started looking at the others. This guy, all of a sudden, he deteriorated.
Sir, I'll just interrupt. Can you
Yeah,
please do it on the presentation mode, the slides?
yeah, I'll just do that. I'll just do that. I think, yeah.
Yes.
So what happens is that I just try to, in the kind of time, this guy was a good student. Suddenly there is impairment in his school behavior, performance, in his mood and all that. Parents were worried about that. This happened over the period of 5 to 7 months. He was not able to finish his work. We see a lot of cases these days. So every this was being referred to people around, and there were two pediatricians who saw the case, and later on they said there is nothing there is something in the mind, and he was eventually went to a psychiatric consultation. And once the psychiatric consultation, how things goes up with the one medicine to other and all that. In spite of all these things, what happened was this guy was deteriorating uh, incessantly. This was something. So, as a kind of thing, what we tried working out in the integrative model and how we tried to work out. I'm really happy somebody was mentioning about hair test and all that. We started looking at what are the things which he was taking all the thing, and we parents were quite inquisitive. They read everything on the Google. They in fact brought me a lot of literature about ADHD and said, doctor, what we can do for him. So and I somehow it basically it makes us more interesting, trying to convey to the people. The parents were quite very proactive. Then I started working is home water, check this kind of stuff, whatever the things and all that. And we came back to some of the tests, and on our insistence, the mother also was she also took the test, and it was positive for lead, mercury, and all that. So what I was trying to put across in this particular case was the thing which changed that child's behavior and all that. Probably they changed their home, number one, and the second thing was there was a change in water filtration system and all that. That were the two major episodes, major things which caused this turnaround. And we now we understand how this lead is causing problem, how this cadmium, so many things. I To be frank, I started my work literally on autism. Then we worked on hypertension, basically tried working with all kind of lead toxicities and all that. And now we have reasons to say that yes, you need to work out something better. The people who are having this coronary artery disease, heart disease, all this stuff, they need a better thing. I'm very confident about the TSCT trial 2, which has been already done. Now that by 2023 TSCT trial T is going to come. And what makes us very excited, when we started, Lenny, myself, all Dr. Hasim, everyone, we were on the same page. We thought ki this hardening of the vessels has to be looked in some other way. And we are quite excited about the kind of results what TSCT trial 2 gave. And I thought ki it is only the cardiac problem or autism, but to my surprise, I'll be giving subsequently one more gynae case. I'll share that particular stuff. So I can always. I asked Preeti to share my PPT with all of you. You can just go with that. This is the typical ADHD and all that. How it came into kind of stuff. I don't want to waste my time here. Just want to tell you that this is the nothing against the pharma, but what happens is that whenever a child with this hyperactivity and all that, he he's labeled as ADHD. He's put on something called Ritalin and all that. Somewhere, this what happens is that he's always on that particular mode. There's a band-aid, and one with one tablet, another tablet is added, and nothing is being told about what are the how you have to follow simple things. I'm really happy. Dr. Garg was also talking about some, he was also on the same page. And we are really kind of thing. In fact, when we take up this kind of cases, it's a big kind of learning experience for we ourselves, and the parents are proactive. They want to learn. And the moment I tell them, you need to switch off your Wi Fi, start using a LAN cable for a connection, I think most of the people, they just they don't follow that. This is one of the big things which we are trying to work it out. We try to tell about the diet and all that, and absolutely yes, we are now working with some kind of, our dietitian is a separate kind of thing. I said, आप भूल जाइए whatever you have learned before. I need my diet to be followed, which is what we have been listening from everyone today. We call it as a detox diet, and everyone tries to be on the same page. So this particular, what gone wrong for this child? 11-year-old child suddenly having a 130 IQ suddenly drops to 70 and all that. What is this particular thing? Is it the altered neurophysiological frontal lobe syndrome from a biochemical rather than a physical trauma? We are here to prove that particular stuff. I, being a functional in the kind of radiology also, there is a thing term called functional MRI. There's a thing called a PET scan, and these are all called functional imaging. Whereas the CT scan or MRI, normal MRI, will just show the structure. It doesn't show anything what is going up and down there. So what we are able to figure out in ADHD, autism, and all that, there is a hypofunctioning, suboptimal functioning in the frontal lobe, in the temporal lobe, in the cerebellum. So that gives us a very good idea ki how we can always work it out. So when someone has a abnormal frontal lobe functioning, or you have that autism has got a kind of problem with the temporal lobe, and there is a biochemically there is a upset here. You are not getting that proper glucose absorption and all that. So I cannot term that thing as a functional in the sense psychiatric. It is not. I think it is wrong from our side to put it everything into psychiatrist's hands and just put him on some kind of it goes to the behavioral therapist, it goes to speech therapist, and the how things goes after all that. So the idea here is trying to look at the biochemical cause and try to treat it. This is one more second interesting case, which is a 37-year-old married woman with a history of a lot of premenstrual symptoms and all that, and it was diagnosed. They went into from one gynecologist to other. Went. This is a very common story. What I see these days. I just wanted to show this particularly. All these symptoms and all that. Any functional medicine doctor will definitely jump. Okay, we'll put her on progesterone, and yes, putting on progesterone is going to be a good game changer here. I just want you to see slightly beyond that. What happened, how things we try to work it out. See, the first thing we learned, I'm a old, completed my medicine in 1990, but what our teachers taught us was the history. You need to elicit the history, what exactly patient has been doing and all that. Somehow we are with a good AI and all that. Definitely, Dr. Chopra, we would like to come to you. Amazing technology you had shown us. Yes, we would like to look into slightly more deep kind of stuff. So everything this lady was told with the premenstrual problems and all that, some depression and all that, she was given a diagnosis of depression, and she was on medications and all that. Because of her work and all that, we went ahead, went on to see everyone. Even neurological examination also was conducted, and apart from ECG, she had some atrial fibrillation also. Everything was done, and later on all things were put across as a depressed case. She's the depressed case and has to be done. So thing is, how much as I'm really this we need to look into beyond that. We are not interested in some just a band-aid treatment and just follow it for years and years. So in the kind of history, we were able to pick up this girl. This lady was having a kind of she was working on a beauty parlor. And nowadays you don't have to work in a beauty parlor. Dr. Preeti, you should tell what are the mascaras, so many things. Everyone goes through that. I had really tough time convincing my wife not to go for some of the beauty parlor work and all that. Somewhere I think all that bleaches and all that. I think this is a big thing. So when we started working with this patient, with listening to everything, we told her to stop going to that work for some time. She has to take a break and all that. And I personally visited that place, small, almost over 100 SFT space with a poor ventilation and all that, poor kind of thing. All the chemicals outgas there, and that was probably a lot of endocrine disruptors, EDC chemicals, what we call now. That was causing her problems. So that immediately worked, and the moment we stopped her, asked her not to go for that particular thing, and after that, see, the thing is, when we are in the last session also we were discussing about detoxification. What are the things? But first of all, we try to work it out. Yeah, we first you have to look at what is ongoing toxicity. Ongoing toxicity, I can always give a one more example if the time permits. I can give you an example of a 32-year-old person who came to us for a Parkinsonism and all that. He was doing his this thing also. He was basically trying dialysis also. He was on dialysis, Parkinsonism, and he used to come to us, and we picked up high levels of lead, and we started detoxing it. Again, he was here for 5 days in Hyderabad. He goes back to his village. In the village, it is something 300 kilometers from here, Vijayawada. So again, after a month, again he comes with the same symptoms, and this happened for twice or thrice. My patients, outstation patients, they do phenomenally well, and now we were in a catch. What is which is happening here, and where I am missing it. Then I started talking to their family members. What are the things he's taking? They said, no, he's a divorcee. He still sits down wickedly. He has no friends and all that. and he is a kind of things. On our insistence, what is the kind of things he's taking daily? I can tell you, I was able to pick up what was the ongoing toxicity there. The mother, out of her own thing as such, she used to give some vibhuti, which was a fly ash, mix that in water religiously for daily, so that she used to think that this is going to get this boy better, and inadvertently she was giving that lead ash to the that particular 32-year-old. So if we pick up from where this is a kind of likely toxicity is there, then we can always be on a so later on we started doing a lot of things everyone has talked about and all that. I'll switch over to a very important another thing, which because of that I
So you have
pretty
8 more minutes.
yeah, I'll just finish the job. This was a thing I just wanted to see this particular picture is on the rise, and I know because of this present pandemic, this is not going to happen by 2032 as Tiffany Sinnett put across. It's going to happen very soon, maybe another 5 years. We are going to see every one out of every two children in the I'm talking about the whole world, not just US. So what happened was, this is my story. I was not aware. I was a practitioner. I was a good at radiology, and I never thought ki first there was a oh, it cannot happen to my kid. This we are not diagnosing it properly. So it took us a long time to understand things and all that, and slowly we tried working on some things. And it was the first child what I see autism is my first. My own son, I was that kind of thing. And now I understand it was a kind of really kind of happy that there is a divine intervention, and somewhere God puts you into that particular dock, and you have to come out on your own. So I started looking at answers and all that, tried to work on that. My son has completing his hotel management degree this year. Almost, I think, just results are waited. But I can always tell you, whatever I worked on that particular case and whatever autism practice I do, I do stage four cancer managements and all that. But I feel this is more tougher than integrative oncology and all that. So there were a lot of assumptions about autism, and we were told my families of doctors in Hyderabad, and they said, okay, this is a developmental disorder, and you don't have to worry. It is all genetic and predetermined, and there's already something is happened, and nothing can be done. So it took me time to understand this is not just genetic. It is a we try to work on epigenetics and all that. If we can go through the slides and all that, still there is a process which is happening, that a lot of genes have been ascribed to that. What we believe is this particular thing, why there is a so much there is an environmental role in autism, and why there is so much increase in number of cases. We need to really work it out. I just try to create a gist actually, and I can always tell you these are the few things which we understood: environmental, air pollution, low vitamin D, pesticides, which are talking about something like glyphosates, flame retardants, antimicrobials, triclosan in the soaps. So I can tell you, someone was asked about how you manage. I happen to work on an insulin dependent diabetes, and what are the things I was doing for autism, I applied the same thing there. And I was told, oh, you have so this is second or third year of follow up of the child, not on any kind of except for metformin. So whatever we have learned in autism, and we were able to apply that particular stuff. So there is a big thing. We need to understand why these rates are rising, and because of this pandemic also, there are a lot of things, as everyone has on the same page. It's not due to genetics. The gene pool doesn't change so slowly, but somehow to mainstream medicine people, it's difficult for us to make them understand this. Everything is being told you have a bad mother or something like refrigerate mother, which causes autism. This is such a 40 years back, Winderham gave that particular concept of refrigerate mothers, and now the still the same pediatrics school, MDs coming out of, they think that it is because of that particular stuff. So thing is, we need to change. I would like to. I'm a Preetiji. there's a thing Hindi song, Bollywood song. I'll take the 10 seconds. हर घड़ी बदल रही है रूप जिंदगी. You have to change. Unless we change,
Right.
we are not going to. That's why we have come all for this particular functional medicine. And yes, I have a lot of things. I can always prove out some things about what is this seafood, vaccines, dental amalgams in the mother, or autistic mothers have got mercury and all that. And so I believe that okay, there must be some cause for that particular thing. So to whatever cases we have done, and we based on the our treatment was based on that particular stuff. Mercury, we tried doing mercury detox. Along with that, we tried doing aluminum detox also. Along with that, we tried to work on some pesticides, flame retardants, and all that. It's a very simple protocol. It doesn't make this one. But if I would not have done that, my kind of the patients, autistic children, they are sick within 6 months. They are talking. Now I can always give you a run for money. You cannot diagnose the child as autistic now. So these are the various things I wanted to share with you because there are adverse vaccine reactions. I believe there is something, and as rightly put across, environment. There is a environmental factors which are you please go through this all this reports and all that. And yes, I can we are this is a neuroimmune disorder, and how we can work it out is a easy thing. But we can stop that ongoing. We can stop people getting into ADHD. We can stop people getting into allergies. We can stop getting people into asthma, but just by changing the kind of narrative, giving the vaccines at spaces, not combining vaccines at one go. One in six vaccine is given in one particular to see. So these are all the things which I feel that the panelists as well as the people who are listening to that, they should understand, because for us, we don't have any other. We can always fix what is broken, but we want to see that uh, first at first place it shan't be broken basically. It takes a hell lot of a time. It's not so easy for to work out for the brain blood brain barrier. When it breaks, it's not easy to fix it. It takes 6 months and 1 year or something. It works. All the see now that luckily the parents are quite proactive, and they want to do everything on earth so that their children are there. So these are the few of the things which I believe people have to look into that. And yes, this any questions, I'd like to rather take it. I think I have overshooted my time, Rohit ji.
You have 2 more minutes for the presentation, then we will start with the questions.
Okay, done, done. So I just wanted to look at, see, even the prospective mothers. I want to give this message out because we had worked with more than 40 parents now, and all of them had a first kid who had autism, and there was a big dilemma whether to go for second kid or not. In the sense, because whatever is being written there, 50 to 70% chances of a likelihood of a second kid getting into autism. So I created a plan where I tell them, okay, these are the measures you have to take pre-conception, during pregnancy, and post pregnancy. And I can tell you more than 45 parents, and everyone has a normal child. Nobody is autistic in their family now. And to whoever we are trying to work it out, it is basically, I think it goes with all functional medicine, every kind of thing. You had to, treating autism is like a tough thing because the parents are already on Google and all that. They read everything and they come to us, and you need to put a point to them. That is a very challenging particular thing. And most of them, they don't realize that this is because of some vaccination. I'm not just talking about one vaccination here, but I'm just telling about the timing and all that. If your MMR is given at some point of time, and you give 5 or 6 vaccines loaded at one go, your body's immature immune system, you are not allowing that immune system to mature properly. And that's the reason we have got all these 4 A's. One is autism, second is ADHD, third one is asthma, and the fourth is allergic disorder. Kane Bock, Kid Bock has done a good work, And this is something which we see rising like anything. I don't understand. We need to really work it out. And there are big factors. I feel one is the vaccination, inappropriate vaccination given at the wrong time. The other one is the Wi-Fi, which is really playing a havoc here. And other one, what I think is your gut microbiome. And your gut microbiome, without any reason, you don't take antibiotics, you don't take any kind of, or you still or take organic foods also, but the kind of thing what has been sprayed over the fruits and all veggies and all that is it's a tough thing. I really I for to me I think everywhere I try to look at where is this glyphosate, and I'm somewhere we need to follow everything on the thing to use that. And last thing I'd like to tell about the precautionary principle is the simple principle. Every doctor should understand that you cannot sit back till we have 100% evidence of everything. We need to start proactively, and this is how we work it out. And treatment depends on the deals with toxic environment. The moment I tell them toxic environment, I'd like to work on mycotoxins. I have seen moldy houses these days, and if that moldy house, that wood which is getting mold, if we are not able to fix that particular thing, I tell them to move out from that home. The people are not aware about this. People do some kind of pest control in their 2 BHK flats, 3 BHK flats. I also stay. My neighbor doesn't understand that. Ki, Are pest control, Doctor Sahab, how is it? So what happens is that you do pest control for a day and you lock the home for 2 days and you go out. But this pest control, what you have kept in your home, it outgasses throughout. So we are dealing with all sorts of things. We have to be more. I think this is the way forward, and it is a kind of it's a big overwhelming kind of process. I don't think anyone can understand this unless doctors can understand, and people like you, people who are really interested. We can always talk about all these stuffs and try to. Most of the parents, fortunately, they start thing and all that, and they start on the path, and we work on this all
Sir,
these
I'll
kilometers and all
take
that
up a
stuff.
question from
That
the
yeah,
chat.
yeah.
So we have a question: how can we increase the memory and learning capacity of a child who has mild autism?
Yeah, this is a slightly, it's not a simple question. I think this is the most toughest question what I could ever face. They just look at something like IQ from this one to this one, how it happens and all that. As I told you, first look at the ongoing toxicities, try to stop that particular stuff. The same thing, I was doing some case, it was a scientist's son actually, and I can always give you that example. What we picked up on that particular case was um, uh, the, they used to prepare something like a delicious food called biryani in Hyderabad, and the family used to eat every week or something like that. There is a thing called coloring agent which was added, and because of the scientist guy, I'm a very educated family. I said, okay, what is that coloring agent? You get me? Because they were following everything, but the child was not improving at all, and we were able to see that particular thing which was high levels of lead was there. They were adding lead, and to my surprise the child had 1 or 2 micrograms per 1 or 2 was the value. And we checked for father and mother also, both were professors, and they had something like 60 or something like that. You should not get more than 5 or 10 more than 10 levels. So you need to first stop that. Where is the ongoing toxicity? You should stop. Try to do some kind of methodologies, and whatever we are trying to put across, you have to see that they take good essential fatty acids. Just by increasing the essential fatty acids, you can improve the brain kind of stuff. And at the same time, I would like to tell you, it's not we try to work with something like pulse electromagnetic field. We try to work with some laser, low intensity laser therapy, sonotherapy, hyperbaric oxygen, and everything. We need to go with a 360 degrees approach. And because somewhere I believe that if somebody comes to me within 6 months, they should get totally normal. That's the kind of thing. Yes,
Yes,
it's
sir.
sometimes challenge. You can always show that 10 to 20 limit, But autism people, the parents are interested. The first thing they'll ask is, what time this guy is going to talk? Because I had also the same question. I
Yes,
was
sir.
asking the
So
same.
we will stop here. I'm sorry to interrupt.
I understand.
Yes, but thank you so much for sharing your insights. I'm sure people here who are listening, they really found some very valuable practical insights. Thank you.
Yeah, it's pleasure of mine. Thank you.
Depression is a rising concern worldwide. Approximately 15% of the population in India suffer from depression. But it's important to know any brain disorder does not always start in the brain. Before solving any health problem, it's important to know what's the root cause of that disease. Today, we have with us Dr. Vivek Kadambi. He'll help us understand how low T3 can cause depression and learn strategies to solve the problem. Over to you, Dr. Kadambi.
Yes, I can't share my screen until Dr. Praveen exits out. So I'm waiting for Dr. Praveen to exit or allow permission to say thank you very much. Can you hear me, guys? Am I audible?
Yes.
All right, that's good. So let me share my screen and just let me know if my first slide is clear. Let me open up. Hold on, let's go on to my second slide. All right, so let me minimize this. Is my first slide visible to everybody?
Yes, yes, Dr. Vivek.
All right, good. So, well, Dr. Preeti knows me. I'm always a performer, always on stage. So you might find my presentations a bit more dramatic than others. But I couldn't help seeing some of the questions that came. And I'm so happy to see 200 plus participants. I know Preeti very well. I'm not very surprised. I think I call her the future of one of the best anchors I've ever known. I mean, not just in medical fields. It's fantastic. So coming to that, somebody was asking about courses for functional medicine. Remember this, functional medicine is a very, very wide. It's extremely wide. You have to attend all courses. I've attended A4M, AMG, wherever I got a chance. So initial couple of years, you're attending all courses and then you decide which part of functional medicine you would like to do and try and use that part of functional medicine, which is closer to what you're doing. For example, for me, my area of functional medicine is of course hormones, is of course bioidentical hormones. I have courses, online courses that I take for functional medicine and training on how to do not just bioidentical but all hormones. And therefore, it's important that you do your own study, you do your own understanding. It's more about changing your mindset. Now, having said that, let me come to my topic. So this is a beautiful topic that Preeti has given me, and I like the wordings. T3, the missing link in depression. So everything has got. So before I come to T3 or the thyroid treatment or thyroid relationship to depression, the missing link is very, very apt over here. Why? Because when somebody talks about depression, we know Dr. Praveen just spoke about ADHD, we talk about autism, we talk about depression, we talk about all psychological issues. The first thing we think of is it's a problem with the brain. It's a problem with the psychology. It's an emotional problem. Psychiatrists, therapists have to handle it. The other extreme is they say, no, this is just a normal thing. It's teenage years. It's part of menopause, part of perimenopause, part of pregnancy. So it'll go away. Don't give it much attention. So I think that's where it's important. We are missing something. And the link is hormones. Today, I'm going to focus on T3, but the link is hormone. And I don't have to explain to the audience over here, because among the audience, I'm sure there's expert functional medicine doctors and there are functional medicine aspirants. Now, you all know very well that we will always talk holistic. We'll always talk root cause, and we'll always make sure that it is integrative. So, but for sake of discussion and for academic discussion, we have to focus on one aspect, in my case, the T3. So the other rules of functional medicine will apply, and I move on to my next slide. So let's start off with something that everybody has to believe. Hormone imbalance can impact mental health. I can't think of a single person not agreeing with this, because all you have to do is look at what happens during menstrual cycle. You have to ask a woman, how do you feel premenstrually? How do you feel during pregnancy? How do you feel during perimenopause, menopause? And you know that in general, yes, hormone and the mental health go hand in hand. The only question is, how much of that can we control? How much of that should we control? And how much of that should we allow as a natural development? Because we all can't be zombies. That's the problem I have with the medical treatment, SSRIs, tricyclic antidepressants. I don't say they don't work. Of course they work. But the question is, you want a person to feel sad when there is a sad event and feel happy and thrilled. You just don't want extreme emotional expression. So therefore, it's a balance. So here comes the most difficult part. What I consider as an imbalance, another person or a conventional practitioner of medicine may not consider as imbalance. So it's tricky. Therefore, the most important aspect of functional medicine is person-centric or patient-centric. So if you are patient-centric, then it's a therapeutic partnership between you and your patient. Therapeutic partnership between you and your patient. When you say therapeutic partnership, is that you and your patient decide to what level you take the management to. That's very important to understand. It's fundamental to the definition of functional medicine. All right. Sometimes when I can't see an audience, I don't know, but am I audible? Am I continuing, or I'm just talking to a...
No, you are audible, Dr. Vivek.
All right, good. Because, you know, you lose track over here. Okay. So I'll just go through depression. Just look at the left lower part. And I'm just going through, we all know insulin resistance, raised cortisol, thyroids, of course, vitamin D deficiency, low testosterone, low progesterone, low estradiol, omega-3 deficiencies, antibiotic dysbiosis. There's so many things that can cause depression. And luckily for us, the same things cause metabolic disturbance. So when you're treating, for sake of understanding, you may separate them out. But if you're treating metabolic disturbances in a holistic manner, believe me, without even realizing it, you're also treating the emotional aspect. But you need to keep an aspect, control and understanding of the emotional aspect, because some people need more of that and some people need less. Obviously, when you go to a restaurant also, each one says, I want more spicy, I want less spicy, I want more sweet. So you need to know in every case how you will modify and what's where the, in that particular case that you're treating, what is important not to you, but to the patient. All right. So I put vitamin D3 always on right on the top. Unfortunately, this talk is about T3, but vitamin D is number one. If you have not optimized vitamin D3, you're wasting your time. I think no functional medicine doctor should be, or worth their salt should even be here if you do not realize the importance of vitamin D3 for all aspects. And remember, vitamin D3 is a hormone or a prohormone. Then progesterone, testosterone, cortisol, DHEA, melatonin. Again, all of them good topics for a separate lecture, but let's focus on T3. I'm also talking about, I also make a small mention, B12, zinc, and copper. All right. So the star of today's show, and drum roll, is Tarataran T3. Now, before we go into T3, when I talk thyroid, remember, if I am mentioning the word thyroid, I'm actually talking T3. So for me, there's the focus is always on T3. So let's have a quick recap. The thyroid is supposed to 80% produce T4, 20% T3. The T4, again, 80% of these converted to T3 and about 20% to reverse T3. Okay, all this is ideal situation, but it doesn't happen. The question is, if this happened, then nobody would need thyroid treatment because the body would balance it very well, 80-20, 80-20, 80-20. Like you put 80% in equity, 20% in debt funds, and the mutual funds do very well. There are no market risks, and you're quite happy with the returns you get. But unfortunately, that doesn't happen. What really happens? Just make a note there, reverse T3. Again, I'm not going to go too much into this. If you look at the factors, abnormal cortisol, vitamin D deficiency, high antibodies, ferritin, estrogen dominance, they're all cause reverse T3. And therefore, all these factors that we know are not very good for the thyroid. But there's a very important factor called T4 medication. People don't realize the more T4 you give, the more reverse T3 that's produced. So therefore, many times you're getting some effects, let's say with L-troxin of 25 micrograms, maybe 50. And then when you start increasing it, the patient actually says that I'm feeling worse. It's not that I'm not feeling any improvement. I'm actually feeling worse because the body, part of it is defense mechanism, starts converting that into reverse T3. Okay. Now, if you look at T4 to T3 conversion, and I'm just looking at, don't focus, this is a very noisy slide, but don't focus on that. What I'm trying to convey over here is low progesterone, low testosterone, low HGH, kidney, liver diseases, diabetes, aging, stress. So if you just look at this, I can think of at least 5 things that I have that is coming in the way of conversion of T4 to T3. So anybody that sees this will actually see that there are many reasons why the T4 doesn't get converted to T3. And the basic starting point is 12% to 36%. I've got a D2 enzyme defect. They're not able to convert. So in other words, you're very, very lucky if you find someone, particularly younger people, you could say to some extent, but very lucky if you find someone very, very efficiently converting the T4 to T3. Most of the time that doesn't happen. And therefore, though the T4 is pretty good, T3 is not bad, you have a lot of symptoms. When you have a lot of symptoms, and the unfortunate part, unfortunate part of thyroid, or if you look at any metabolic disease, is that the symptoms are so wide, anything from falling of hair, skin problems, even gut issues, if you talk about weight issues, we talk about energy levels, sleep, practically everything comes under that. So the body, if you think of the body as hormone incorporated, to me the thyroid is the CEO of that company, and the insulin is the COO, and all the other hormones, depending on the hierarchy, they are there somewhere. But typically, when a patient comes to a functional medicine medical practitioner, that means they've been around. They don't come usually directly, and they have been showing a normal TSH, a normal T4, and maybe low to low normal T3. But they have all the symptoms, and they're very unhappy. Now let's talk about the emotional symptom, because we're talking about depression. So there's keep going around. So just a quick recap: the TSH is the most inaccurate, the most unreliable, independent indicator of thyroid function. Okay, so TSH, I'm not saying we should not do that. If you do a free T3, free T4, and TSH, you have a better idea. But do not go by blood levels. Do not treat blood levels. We have been taught that in medical school also, that you treat the patient, you don't treat the blood levels, don't treat the labs. But unfortunately, when you come out of medical school, we tend to, many of us forget that. At least I forgot that, and I went into mainstream. Now, thank God I'm not there anymore. So just remember TSH, most people, we're talking about a high TSH is a primary thyroid gland problem, which can be subclinical or overt. These are the people where you get a classical high TSH and maybe a normal free T4 or even a low T4 or T3. But most of the other ones, which are not very common, which is pituitary and hypothalamic of origin, you will get always a low TSH and everything going low. So do not break your heads over that. The point over here is, do not go by the levels that you see in the labs. Just go and see that let's get good free T3 levels. Let's get the T3 up to good levels, and let's keep the TSH wherever it goes. Do not panic over a too low TSH also. Now, psychiatric manifestations of hypothyroidism. So there are vegetative, cognitive, mood symptoms. So when you look at T3, and though I'm talking about depression, again, remember in functional medicine, you can't separate a different treatment for depression, a different treatment for mania, a different treatment for ADHD, a different treatment for even metabolic. So you have to start, always think holistically, but focus on the symptom for which the patient has come. So let's again focus on depression. But when I'm talking about depression, I'm talking about all mood disorders, all kinds of disorders of the emotions. So let's see, how does T3 hormone help? Let's understand how T3 helps, and then everything will fall into place. Because once you understand, the treatment will just follow. So let's take one of the hormones. You know, T3 regulates the level of action of serotonin, norepinephrine, GABA. So these are all the happy hormones. You can name all the happy hormones, but let's take just serotonin as an example. And the serotonin is decreased in hypothyroidism if you're deficient, and it's more common than we know. The thing is, we don't check those levels and we'll never know. But remember that if you give T3, then there's a rise in the serotonin. That's very important to understand. And the rest of everything else will fall into place. So there are many hypotheses, proposed mechanisms, but let's come to the brain, where we presume that all the emotions come from the brain. It's a presumption, but let's take that as true, that the brain produces. Remember, the gut is also another brain, but that's a different topic altogether. So let's say the brain converts, has more T3, it has the more serotonin it produces, and you're happier. Very simple. Liver also converts the T4 to T3. That circulates, part of it will go to the brain, and they're happier. But in another factor here is that the T3, a lot of us don't know, and I also didn't know for a very long time. It also plays a role in the in leaky gut syndrome. So that's where the probiotics also apparently allow the conversion of T4 to T3, and therefore in 80% of thyroid cases that I see, there are cases of Hashimoto's or autoimmune thyroiditis. The T3 itself fixes the gut. The probiotics also fixes the gut and do all the other things. As I said, my disclaimer here is I'm talking about T3, but the assumption here is in functional medicine, you start with vitamin D, B12, omegas, probiotics, take everything holistically and then come to that. Again, let me bring the focus to T3. Okay, so there's a lot of literature available, but I'll simplify it for you. Okay, make it very simple. These are a very complex chart, but very simple. Exogenous or endogenous T3 will cause increase in serotonin. That's all that you need to know. If your patient is taking lithium, carbamazepine, fluoxetine, any of these drugs, SSRIs, tricyclic antidepressants, they allow the conversion. They promote the conversion of T4 to T3, and at the synaptic levels, they are increasing the serotonin there because they prevent the reuptake, or MAO inhibitors, they prevent the metabolic on that. So that's fine. So two different mechanisms. And thyroids, T3 particularly, causes increase in serotonin. So this is why they become synergistic. That on one hand, because if you have two drugs or two, we can call them drugs for the time being, having the same action, then you'll get only additive effect. You won't get synergistic effect. So, but if you have somebody increasing serotonin, other one reducing the uptake in the synapses, and third one also preventing the breakdown of 5-HT. So all this put together become synergistic, and therefore, at the very least, what will happen is there's somebody already on the treatment, the dose will come down, especially lithium, which is very toxic. It's very important to get patients off lithium as soon as you can. All right, but it appears that there may be a subgroup of depressed patients with specific demographic, clinical, and genetic characteristics who may benefit specifically from the use of T3. Less evidence is available to support the use of T4. So, you have to go search online all these journals, and this, believe me, it came from a Hebrew journal. I got a translation of an entire article which is in Hebrew. So, your course, your library is at home. It's all there on the cloud. I thought it's interesting and I picked that up. But remember, in the journals, usually the words will always be maybe, should be, could be, because nobody wants to commit very strongly as far as the published matter is concerned. So let's take, I'm taking it random. There are thousands of articles that let's take tricyclic antidepressants. This meta-analysis and analysis supports, I'm sure you understand the importance of meta-analysis, supports the efficacy of T3 in accelerating clinical response to tricyclic antidepressants in patients with non-refractory depression. Furthermore, women may be more likely to benefit from this intervention. Now, of course, there's easy to understand why women will benefit, because firstly, of course, hypothyroidism, Hashimoto's is commoner in them. And also there are other hormones like progesterone, estrogens particularly, and testosterone that go up and down, and therefore they're more likely to benefit. Okay, nice article. The other interesting part in some of the articles,
7 more minutes.
7 minutes. Other important part is that use of T3 augmentation, 25 to 50 micrograms. Now, it took me about 10 years or more to actually get into good doses. And some of my patients are in as high doses, 150 micrograms per day of T3, some of them 2.5. So that you can't say what is the dose in this particular case. You have to go individually. You have to see their tolerance, look at other matters. But important is treatment of depressive symptoms in some patients without thyroid hormone abnormalities. So it's all there, even without thyroid abnormalities, who do not respond to adequate trial of tricyclic antidepressants or selective serotonin. So it was a psychiatrist, actually, it was published first in psychiatry journal, not in endocrinology journals, that the use of T3, use of testosterone, use of hormones to actually treat depression. So it's very important to know that the endocrinologist journals will probably be the last, because they are busy treating the endocrinology diseases. But psychiatrists are ones that can actually go so high that I have a psychiatrist who tells me I don't even measure TSH, just go to the level that I can clinically treat the depression. I'll take the rest. So this is how it is safe, effective in unipolar, and of course in bipolar. I particularly like to mention about David Nutt, because I like the name David Nutt. It's a very apt name for a psychiatrist. I've never heard of a psychiatrist whose name itself, last name was Nutt. But anyway, what he was saying is, when I go through all this, I agree with him that it's good to see these studies validating what we are doing. Now, if I were to look at the studies, I won't go through that, but all of them talk about that may improve mood, psychometric scores improve, supraphysiological dose of T3, supraphysiologic dose of T3. When you get your confidence level there, you will be going to those levels, but do it with the help, under the supervision or care of a psychiatrist. Simultaneous, initiation, or you can initiate separately, no problem. And they have enough articles out there. Ashok Kadambi, endocrinologist, board certified in the US, says, yes, I do sometimes make one of the TV interviews, patients hypothyroid. Actually, they adjusted themselves. And the normal free T3 levels actually used to be much higher, 3 to 6, now some say 4.8. So don't worry what the lab says. You decide what the normal T3 level is based on what literature says. All right. And there's a lot of books on this. The thyroid solution is one of them. The clinical impact is major portion of thyroid is due to the free T3. So you have to actually focus on the free T3. Psychiatrists are actually bringing people back to life. Sometimes it is that dramatic. I can tell you stories after stories, but there's no time for that, but beautiful stories on thyroid, how it completely changed people's lives. Now, I'll just take 2 patients, a 39-year-old female who, after many years, and in fact, did not even tell me that she had any issues, emotional issues. She actually said, I have, in 2010, after 3-4 years of management of thyroid, I have felt the impact of hormones on mental health. She has a wearable device, so I can monitor her pulse when I go push it to high levels. And she says, I feel better when my free T3 is more than 4. Great, that's good for you. And I think you're fine. 2 days ago, I took double dose, I felt better. So I said, okay, don't double your dose, don't increase your dose, but divide it into 2 doses because of the half-life. Patient then told me, you know what, doctor, I was advised SSRI many years ago, but I did not take it. Now I'm glad I didn't take it. Now, last case, 17-year-old, very common, PCOS, everybody's focusing on metabolic. She has panic attacks. She has missed cycles. She has all the problems here. As you can see, anti-TG, anti-TPO is high. TSH is also high. You manage the thyroid. You manage the thyroid metabolically. You will also manage the moods. Okay, but she will need much higher doses because she has those problems. Thank you very much. Go happy with endorphins, oxytocin, serotonins, and what have you. Questions?
Thank you, sir. So we have a question: is T3 available in India?
Oh yeah. Okay. So for those who don't know, I think you can get the address from Preeti. We compound it for our patients. So we have just to give an idea, over 150 types of combination of T3, T4, T3. So yes, it's available as compounded T3. There is also an uncompounded manufactured T3. I don't know how well they work or what they do, but the doses are, I mean, the strengths are available are very low. I think 5 or 10 micrograms. To me, it's like this. Some people say, oh, I've used T3, but it doesn't work. But if you use 5 and 10 micrograms, it's not going to work. Yeah, sometimes you need 50, sometimes you need 200. So yes, the best way I can tell you is it can be shipped anywhere in India or abroad as well. I run one of those compounding pharmacies and supervise that. So anybody wants to know, go online, compounding pharmacies India, you get it.
Dr. Vivek's details have been shared in the chat.
Yeah.
And otherwise, you can reach out to Ruhi, me, anybody, and we'll share the details.
Yeah, it's very tricky. To compound thyroids are not as easy as compounding. The other creams are easy, progesterone issues, but compounding thyroid is very, very tricky because the doses are very well done. So we have a very stringent QC, you know, that's important because that's the only way to do thyroids. Without compounded products, very difficult.
Right.
All right.
So, doctor, we have a question. What's the protocol to slowly taper off thyroid medications after diet and lifestyle changes to bring the levels back to normal?
Okay. One is that each one protocol depend on what their strength is. So in my case, it is T3. So I will be, if there is a person who's treating, for example, if Dr.Praveen is treating or others who are treating and they have Dr. Mahesh, I know, very good at the nutritional part. So you can decide based on the clinical symptoms. But I can give you one tip that most of the time a person looks at the thyroid and says, now I'm feeling good. My and remember with T3 or TSS really goes low, 0.05, 0.05. So, you know, when you do when I do the courses, I explain to you why you should not have a, you know, what you call knee-jerk reflex and reduce it. So don't be in a hurry to reduce it because the moment you reduce it, they'll feel fine. They say, oh, I'm feeling great. But then the tissue levels will start coming down later. Blood levels will come slower, and then it'll be like a ping pong. So the protocol for reducing is that you have to titrate it with the symptoms and not so much with the blood levels. Sometimes the symptoms can be objective or subjective, like a heart rate going up or person's exercise capacity not being there, or a person has taken a vaccination or had COVID. Then I tell them, okay, let's not do anything in a hurry. Let this thing go off. Let the vaccination effect wear off, and then we will get back to your fitness or whatever you do. So there is no fixed routine. There is no fixed protocol. And sometimes you may never be able to take them off. At least I won't, but maybe others will, some other functional medicine doctor. All right. So good question though.
Doctor, we often see, I mean, usually in conventional medicine, you know, the TSH, the T3, T4 and TSH, you know, it's always about managing TSH.
Yeah.
In many cases, we see there is just no correlation between TSH and the T3, T4 values.
Yeah, so I know.
What would you say about that?
Yeah, it's tricky. So what happens is that sometimes, and I get a call from the anesthetist, patient in surgery, says you're the doctor treating it, the TSH is 0.02. What do I do? It's so low TSH. What do I say? What is the free T3 levels? What are those levels? He says, I've not done it. I said, do it. Then they come back and say, wow, it's actually quite normal. The free T3 is quite good. Free T4, what's happening? I said, treat this as a euthyroid. Okay, trust me on that. Don't go by the TSH. You don't make any changes, but it's always confusing. But we know in medical school, they're taught, don't go by TSH, don't go by TSH. But when you come to legal responsibility, that poor fellow has to do his job. Anesthesia has to give fitness. When they have to give fitness for somebody with a TSH of 0.1 or 0.02, they are scared because they don't know what's happening. And they don't do the free T3, T4. Therefore, you have to step in, and I give the certificate sometimes. I said, if those are the levels, I'll give the certificate. But yes, it gets very confusing, and I get a lot of calls from especially anesthetists and physicians before fitness for surgery. What do we do? It's not easy.
Yeah. Do we have medication for colloid goiter?
Yeah, see, goiter, let's not mix up functional medicine of thyroid, what you manage, and the goiter. So management of goiter, whether it's hot, cold, colloidal goiter, iodine, no iodine, surgery, biopsy, FNAC, So do not think that functional medicine will replace that. It's very important to understand that mainstream medicine is fantastic in a lot of aspects, and then you have to only be a complement to that. So when it comes to a surgical issue, let them handle it. When it comes to a person with Graves or hypothyroidism, sometimes ablation is the best thing they need. And after that, you can manage thyroid. So do not ever think that I don't know about others. Sorry to disappoint many functional medicine practitioners. We cannot replace the mainstream medicine for what they do. Let's take what's good with them. Let's run with them and do what you can do. So if it's a goiter, then you're looking at a nodule from the surgical and whether it's cancer or not cancer, etc. Or if it's a very clearly a iodine deficiency goiter, then to give the iodine. That's not an issue. But be very clear what you're treating.
Right. So Dr. Vivek, we still have 2 minutes. If you still want to add anything, share something with the audience.
Yeah, I can say one of the things is I'm so glad there's 200 plus audience. So I think one of those things that a lot of people who've come here, they're probably aspiring to be functional medicine practitioners, don't know how to do that. I saw those questions coming up. I think my point is you start from anywhere. It's like a book. You don't have to start from the beginning to the end. You start from the middle, you start from the end. But make sure you attend different sessions and attend different people and then choose your guru. To me, it's very clear. Finally, you have to find a guru. I found my guru in Neil Rosier and Dr. Ashok Kadambi there, and I follow that. And there's no right or wrong, because even in our Asian times, you have to follow one school of thought. But do not demean the other schools of thought. Do not look into the other things of thought that doesn't work. And try to make it in such a way that you give your contribution. Do not give unrealistic expectations. When it comes to depression, these children that I'm treating with emotional problems, the problem with one message I'd like to give: do not patronize or do not brush aside the psychological or emotional problems of teenagers and saying, oh, this is teenager, she's getting teased because she's fat, she has actually insulin resistance, she should lose some weight, or she's growing a beard or whatever, she's got hair on fur, people are teasing her, flat chested. But no, look at the hormonal imbalance and take it seriously. And it's very difficult to treat depression by any method. So do not be very careful on two things. I'm very careful. When men ask me, what do I do about hair on my head? I say, take a look at me. I can't give you any expectations. Okay. When people ask, what do you do about depression? I said, no realistic expectation. It needs a lot of work. It needs your team. I need to coordinate with your psychiatrist. I need to work together. So I think the one important lesson is don't get carried away by your own 1 or 2 cases that did well and then suddenly think that, oh, you got the answer to it. It never happens. You will have to swallow or eat the humble pie very soon. So treat it like anything else. You need a lot of passion, and if you are interested in being a functional medicine practitioner, remember, more effort, less money. It's always that way, but you'll get enough money, but more effort. You have to put a lot of effort and put a lot of academics, but you'll earn well. But the returns are more like debt funds. Don't expect, like the equity funds are doing, because that market can go up and down. So there, I think I've given my message. I hope that helps people.
Yes, doctor. Thank you so much. It was really nice having you with us. Thank you. Now we move on to the next part. Jeevam Health is a health tech startup currently focused on autoimmune thyroid conditions. By using a whole body approach and advanced biomarker analysis, Jeevam Health delivers treatment to resolve the root cause rather than just managing the symptoms. Their treatment approach revolves around nutrition, supplements, lifestyle changes, and optimized medicine. We have with us Piyush Vishwakarma. He's the founder and CEO of Jeevam Health. Over to you, Piyush.
Thank you, Dr. Ruhi. Can you see my screen?
Yes.
Okay, great. So hello, everyone. Thank you, Dr. Ruhi and IAFM team to allow me to speak in front of this amazing audience. I'm Piyush, co-founder and CEO of Jeevam Health. Jeevam Health is a digital functional medicine care for complex chronic conditions, and we are starting with focus on thyroid conditions. Within 12 months of launch, we have treated 1,100 patients and built a strong community of patients and practitioners of 8,000 members. 91% of our patients are implementing the treatment, and we have seen 77% success rate. So 77% of our patients have reported improvement in their symptoms. Whenever someone onboards, we establish their symptoms score and track the high-risk symptoms frequently. Within 3 months, we are seeing that there is an improvement of 35%. And it's not only in the symptoms, but also in the biomarkers as well, like insulin resistance and thyroid antibodies. To understand the overall thyroid persona in the market in detail, we did a detailed survey of 30,000 thyroid patients. And 25% of these patients have reported that the medicine-only approach is not helping at all, not a bit. 35% of these patients, it's helping sometimes and sometimes it's not. So the efficacy of the medicine-based approach is only 40%. We all know that it's not solving the underlying problem as well. If we go a little bit deeper, the majority of these patients are having weight issues. 75% of thyroid patients are having weight issues. And 42% are having fatigue, 17% are even having pregnancy challenges. We all know here how to solve it. We need to create a very comprehensive treatment that covers food, nutrition, lifestyle supplements, and medication. And to create this, we need to analyze hundreds of biomarkers and understand the health in very, very detail. But how will we do it? Look, creating a treatment which takes hours of time and investment will be really difficult to scale to masses, especially in India when there is a very, very less number of doctors and coaches. In India, 42 million people are having thyroid conditions. It's too much. That is where Jeevam Health comes into the picture. We are creating technology, process, software to assist practitioners and patients and scale this innovative treatment approach to millions of people in India without compromising on the efficacy. That's why Jeevam Health is co-founded by IIT Roorkee engineers and functional medicine doctor. With the right blend of technology with clinical practice, we are able to solve this complex problem for the masses. So we started with creating an application for the patients and software for the practitioners. The patient can track their overall symptoms, track the high-risk symptoms on daily basis, analyze the progress, share the challenges with the coaches and doctors. Based on the data, we are trying to contextualize the health components so that the practitioners need to focus on the relevant aspects only. We are trying to analyze the risk profile of different functions of the body based on biomarkers and symptoms. Remember, we need to analyze hundreds of biomarkers across different timeline of patient medical history. So it consumes a lot of time. All these tools to assist the practitioner to quickly understand the health and design a comprehensive treatment approach. To help the patients further, we have started forming a community of like-minded people. Currently, we are running 100+ WhatsApp groups with 8,000 members. They are asking the questions about their health, want to understand the right treatment process, consuming high quality content by functional doctors and coaches. Recently, we launched the feature in our application as well, which is available on Android and iOS. You all can download it, use it, and share your learnings as well as learn challenges, and patients can ask their queries to the practitioners directly. This is the free access membership mainly. We are trying to build a strong community of 1 million members in the next 2 years. Lastly, we really appreciate all the support we have received so far from the functional medicine community and looking forward to connecting with many more enthusiasts. Feel free to connect with me, write to me directly. Would love to chat. I am available at piyush@jeevamhealth.com. Thank you. Thanks a lot.
Thanks, Piyush. Would you like to share any of your success stories? I'm sure the attendees here would love to know about that.
Yeah, there are many. You are also one of the treating doctor in Jeevam Health, Dr. Ashwani as well. So what is surprising that the thyroid patient are also having insulin resistance and high antibodies as well. And we have started seeing improvement in their antibodies are also reducing. And you know that the T4 medication does not help at all in reducing the antibodies. Like Dr. Vivek also suggests that T3 is also very powerful tool. And we'll leverage that a lot. T4 to T3 conversion does not happen in many of the patients. But with the comprehensive treatment, understanding all these biomarkers, we are able to see this improvement in these thyroid antibodies. People are reducing their insulin resistance, managing their cortisol levels better. Ultimately, what is happening that thyroid symptoms are getting reversed 100%. But it takes time because it's a complicated conditions. And when people are coming to us, they are having conditions since like 10 years, 15 years, 20 years after visiting all of the doctors in India. So you know this very well that we are having now a very good success rate where people are now seeing the improvement in their thyroid antibodies as well. So autoimmunity is getting better. That's really good surprising for many of the people here.
Yes. Yes, thank you.
Yeah, thanks a
Thank
lot.
you for sharing this. Thank you.
Can I make a comment?
Yes, yes, doctor.
Just a quick one. I think what Piyush said is very right. It makes bringing people around one platform is very important. And I have, of course, not an organized app like him, but we all come together. But I can tell you that if they all come through a functional medicine doctor where the nutrition, everything is worked up, the dose that I need to give of T3 is very low. The dose I need to give is less. So what happens, it makes my job easier, is also being less. I have nothing against giving a dose of 150 microgram. My point is that if you do the rest of it and come to me, you may just need, or you may not need at all. So that's very, very important to understand. Piyush, you're on the right track. You're doing a good job. I like to talk to you after this sometime.
Thanks a lot.
Thank you. Vieroots is a health tech startup that provides personalized wellness management solution based on genome metabolic analysis. Epilumo is the proprietary program, a personalized wellness modification program using genome metabolic analysis. So what the client has to do is they undergo a Y genome test, which is one of the most comprehensive wellness genetic tests available in India. And it provides information about more than 200 health conditions, including various diseases for which one might be at a higher risk. And using the AI-powered mobile app, one then undergoes a metabolic assessment. And with the help of the medical and genetic team, they combine all this data and design a personalized lifestyle modification. And once you start implementing this, one can completely modify his or her lifestyle based on the recommendations provided by them. They also have a range of high quality nutraceuticals like NAD complex, mitochondrial support, natural vitamin C, omega-3, and the list is long. There's more on the video up there on the screen.
Is there no audio with the video? You have to go to the audio settings and say share audio, or whoever is sharing this. Go to share screen, and when you click on share screen, there'll be one option which will say share audio. Okay, anyway, it's over now. Oh, it's not over. Step 3. So if we can't get the audio, then whoever is presenting it, give a running commentary. So we are not looking at a silent movie.
So Vieroots actually has, a range of really very high quality supplements. Like, as I mentioned, natural vitamin C, natural vitamin E, which is not very readily available in India today. And they have really unique ones, such as the mitochondrial complex, the NAD complex, to support, we heard about mitochondria today so much, and of course we can make all the lifestyle changes and everything, but, to really provide that extra support to the mitochondria, they have an amazing supplement called the mitochondrial support. So that's the mito complex. And given the benefits of curcumin, so they have an amazing combination of curcumin latte, which basically needs to be mixed, and taken.
I don't know if you're aware, even Starbucks is now serving curcumin latte.
Yes.
Which,
Starbucks is also serving curcumin latte.
Yeah,
Almond milk coffee and curcumin latte.
So, yeah. curcumin latte sounds a lot more exotic than haldi doodh. Of course, there are many people that won't take doodh also because of the, vegan diet or intolerance to any kind of lactose. But well,
But they have an option of
haldi.
almond milk, Dr. Vivek.
Yeah. So basically haldi, but curcumin, but not in the kind of things you get in the food. The amount of haldi that you get in the cooking, they are not the medical grade haldi, and it's not enough. Most people say, "Oh, I have haldi in my masala and all that. It's good enough." It's not. They need to take that extra bit. So I can see that we are still around 100 audience. How is soya milk for regular consumption? Anybody? Soya milk.
Recommended too much. One is getting good soya is a big challenge.
Yeah.
And second, thyroid and all has become so common these days that especially keeping in mind that blood tests generally do not give us accurate indication of the functioning of the thyroid.
Yeah.
For the
hormonal point of view, everything has a double-edged sword. While soya should be taken for proteins and it has beneficial properties, but you should also be careful because there are different kinds of soya. And in fact, the source, you asked me about my compounding pharmacy, we can get the hormones like progesterone or testosterone, progesterone from soya also, but we prefer non-soya source. Okay, so the extraction also. So when you look at the same hormone coming from the soya, and of course you can't get it by eating soya, you have to eat a lot of soya to get it. But just remember that the soya is always a tricky food. It's not as straightforward. And in fact, in China, if you travel to China, you almost get soya milk has replaced the regular milk that we get from cows. And therefore, they have a different set of problems. So excessive consumption of soya products is, I'm no expert on that. There are better experts than me on this aspect, but I do know that it throws my hormones even worse than what this COVID vaccine is doing. It throws away the hormones into wild cycles. So it's a bit tricky.
Great. We don't have any questions here, so we'll move on to our next.
Yes.
I can take one question here. What's the role of nano-curcumin in controlling inflammation?
Yeah, I don't know about others. I don't know. So somebody wants to take that answer, raise your hand because you better be quicker than me. I'm the fastest finger first always. So nano-curcumin, I have a person here from Bangalore itself. Yes, it is much better than a normal curcumin because the particle size. So we go for micronization, nanozation. But the question over here is it worth that price, that premium that you pay? Ultimately, I look at the inflammatory markers. You take nano-curcumin, you take this, your dose goes less. I'm finally looking at its effect. And you can't say curcumin is the only thing. You have to look at omega-3s, you have to look at other vitamin D. So between curcumin and nano-curcumin, I would say that yes, nano-curcumin will have better absorption, so your dose will be less. But if you take an adequate amount of curcumin with piperine, that should serve the same purpose. I have not seen a specific advantage, but I'll be very honest. I have not used nano-curcumin. I keep getting the ads, the person asking me, coaxing me to use it for my patients. I think it's that expensive to be convinced.
Cancer patients and all, Dr. Vivek, I prefer to use nano-curcumin.
I agree because the doses are high.
Exactly. And it really shows a good thing.
Good point. Good point. Well, absolutely. Very good point. Cancer patients, just as in melatonin in cancer patients, my dose goes up to even 100, 150.
Exactly.
Very, very high. We have to compound. So yes, in cancer patient, I think there's a huge advantage. I agree with you. And I must remember that next time.
Thank you, Doctor.
Thank you. And with this, we now move on to our last panel discussion. And it's a very exciting one. Thoughts and mental health have a significant role on our physical health. It's of utmost importance to keep a healthy mind for a healthy body. We cannot just treat the physical body without looking into the mental health. In conventional healthcare system, mental health is an area which is largely ignored. Today, we have a very experienced panel with lots of experience into thought engineering, energy healing, and integrated medicine. So let's hear it from the panel. We have Dr. Ashwani moderating this panel. He's the founder of Functional Medicine Clinic and a founding member of IAFM, and happens to be my husband as well. So over to you, Dr. Ashwani.
Okay, thank you, Dr. Ruhi. I think I have the toughest job to talk about something generally not seen, not feel. Yes, definitely we're feeling it, but there are hardly any instruments or hardly any mechanism. But yes, lately we are finding some technologies to see how thoughts and how energetic field is affecting our physical body. So I have a very, very experienced panel with me. I have Janardhan Reddy, who's an energy healer. It's a world-renowned, experienced person. He has been in US, now in Dubai, India. He has done a lot of work. Then I have Sajeev Nair, sir. He's a real coach, which is helping people re-engineer their thoughts and get to their high performance. And of course, I have Marcin with me, who is into testing, which will also help us understand how toxins are playing a role into causing a poor brain function. Then we also have Deepa, Kannan. She is a functional medicine practitioner. Along with that, she's having ancient medicine and functional medicine. She's putting these two together to improve the outcome for her patients. So thank you so much, panelists. I really, really grateful that you could take out time. We are also waiting for Dr. Thomas. Thomas Lodi is a integrated oncologist. I think largely we talked about how metabolic diseases can be reversed. We talked about how gut function can improve the bodily functions, which is critically important. Now, what else we have to do to make sure that we don't get into a disease state, or what we have to ensure that if disease has come, sometimes we do all things in the functional medicine, but still there are 10% of the cases where we fail, or we don't really get that success. But there's always a missing link, which is the energy healing, thought healing, or different names to it. So I go to Sajeev Nair, sir. So first of all, I want to understand your perspective on thought process, how they are impacting the physical body. And then, of course, you can talk about your performance coaching. What is it exactly, and what you do really, and what is the outcome that you drive in your audience?
Thank you, Dr. Ashwani. Thank you, the entire panelist. I think I don't require to explain that much, because here, whoever is there, either panelist or the audience, they are all quite passionate about health and wellness, and maybe they must have read in many literatures how thoughts are impacting the cellular, biochemical, metabolic, even genetic level changes. So when we talk about even genetics or epigenetics also, we talk three things in one tandem. That is the psychoepigenetics, physioepigenetics, and nutriepigenetics. So these are the three ways you can actually make or control or manage a gene, whether to express or not to express, or rather a gene mutation or a variant to express or not to express. And I think majority of the studies right now are going in that direction of epigenetics, which is coming out as one of the leading streams of healthcare right now in the world. And these three are being given equal importance, but some or other, as rightly when Dr. Ashwani in the beginning said, this is not tangible, this is not seeable, this is not kind of visible. When it comes to thoughts, mind, and all those kinds of stuff, we still have a lot of gray areas. When it comes to nutri, and also when it comes to physio-epigenetics, you know exactly the certain things what you can do. We work a lot on this area as we are doing. We are in the field of epigenetic lifestyle management. So, but what my personal experience is that since 2006, from 2000 onwards, I've been into motivational speaking, life transformation, people coaching, and all those kinds of stuff. But 2006 was the year in which actually I got a real kind of, I would rather say, turnaround, because that point of time, I started realizing that it's just not more than motivation, because motivation lasts for about maybe 2 weeks. You pump people up, but it'll last only for about 2 weeks. So I had a good fortune of associating with some medical doctors. And of course, in the morning, you must have listened to Dr. Sri Kumar. So we were partner. We started the wellness solutions together. So I could gather a lot of information, and I became so passionate about neuroscience and how the brain functions. not to the extent of a medical doctor, but still from a peripheral level, how it functions, basically from a functional point of view. And when I started, bringing that perspective, that is, which we call it as a thought process re-engineering, whereby how you re-engineer your thoughts, not just by, just by one methodology, but by various methodology, because generally we say that you change your focus, you change your words, you change your motion. These are three ways you can actually alter the state, because we always talk about altered states. So if somebody is down, if somebody is not well, if somebody is feeling bad, the only way you can take him out of that is alter the state. So if you want to alter the state, there are only three ways: change the focus, change the language, change the body, or change the motion, change the movement. So this is where we found that, significant differences are happening in people's lives, and people change. Because when you are down in the morning, on your bed, you feel like doing nothing. Medically, biochemically, there could be many reasons, like the cortisol level is low, maybe that, because of disturbed sleep, the melatonin must not have done well, the circadian rhythm has gone. But the common man doesn't know any of those things. He feels that I'm down, I'm down. That's the only thing he knows. So the only thing what he can do is that he has to be taught, he has to be educated that, you have to change the entire process in your body. For that, the first thing you need to do is that move. Only if you move, then only the cortisol levels start moving up. Then only you can have the right kind of thoughts. So the overall mechanism, what I believe is that if, this is a big topic, so I'm trying to compress that. But I have seen that just by having a better management of your thoughts, you can even control diseases. You can heal yourself. I'm a strong believer. There are energy healers, reputed energy healers out here. I don't know much about that field, but I heal myself. I know that. I cannot heal others. I don't know. I may be able to, but I have never tried. but using thoughts and using my mind, I know that a person can heal himself. That is very clear.
Sajeev Nair has made the brilliant point. Even though the physical body is sometimes weak, but if we make use of the mind, if we make use of the thoughts, there arises a possibility that we can change our physiology also. So now, in the conventional thought process, this is all still looks like quackery, because there's no instruments on the hardly any ways. But nowadays, but there are some people who has the ability, who has the, I have the experience with working with Jana and few other healers that I know, and lucky enough to know them. So they have that ability to see through what is not happening right and how to fix that and how to help the patient. So first of all, Jana, I want to ask you this one question. What is brain and what is mind? And conventionally, we just keep swapping these two things with each other. Brain and mind, they seems to be the same. But I think you can give us more information on that.
Thank you, Dr. Ashwani. It's a very beautiful question. That is, we always interchange brain and mind. The clients who come to me and they ask, where is your thought that is going on? It's there in my brain. That's what the first thing that comes out. But they aren't able to locate a space for the mind as such.
And Dr. Musakin? Yes, please.
So what is the difference? Is it interchangeable? The first question comes in, is it interchangeable? Can we change the mind with the brain, or brain can be interchanged with the either ways as such? Actually, mind is separate. It is a totally an etheric nature. It doesn't have a space as such. And at the same time, it is inseparable with the brain. Now the question comes, we are saying that, it is separate, and how is it still, connected to the brain? What is happening at the brain level? See, what happens, mind uses the brain to signal or to amplify or trigger the emotions, feelings, and the body sensations that are always present within us. Now, I'll tell you a simple exercise, when we talk about energy healing, we can only, understand about body symptoms. Like, I have got a palpitation. I'm just giving an example, I'm going through this anxiety attacks, I have a panic attack. Now that is a body sensation. The first thing that anyone identifies is the body sensation, that I have this particular problem, what do I do about it? Now this body sensation is, how does it get triggered? Now what happens in the mind, there is a thought that is running in, maybe as simple as I'm going to die. A simple thought that could be running it out as such. Now this I'm going to die is a thought, is a thought which is there in the etheric nature. It triggers a signal to the brain saying that, no, I need to feel anxious or I need to feel sad. And the body now, the brain is sending a signal. See, there's a thought which is forming in the etheric world. Now let us start, bringing that, information to the body. And you start getting, breathlessness, you could be having, nightmares, you can have different things. And the body is also a beautiful way of opening up and reaction, or we call it the behavior. There's an urge, there's an action. What is the urge is something that I plan to do, I want to do, or I intend to do. That is the urge. Action is totally different. I could just go into the bathroom and lock myself and start crying. So this loops continues forever. Now you see that in how brilliantly the brain is just a functionary of the mind to send out signals to different parts of the body to react, respond in a certain manner. So that's why it's like mind has got so much of energy. It's got so much of energy. It's so powerful, and everything that you think, anything that you think, feel, choose, triggers that particular brain signals, and that's what gives you a body symptoms or a body sensation. And every disease, we talk about psychosomatic issues, we talk about metaphysical reason behind tough diseases, why it happens, and how it would be attended through understanding the thought process. Because we are going to one layer deeper into the etheric layer, understanding what is that cause that is making, that is coming from that etheric layer of the thought as such. That's why it's brain and brain is a very difficult thing to to segregate it and things like that. I know it's the mind keeps keeps doing conscious non-conscious activity, it keeps on working throughout. It keeps data churning out, interchanging it, boxing it up, keeping good files or bad files, negative positive feelings and emotions. So it keeps segregating all these things, and the body keeps going back to those files. It thinks, like if they take as an example, like Jana needs this particular information, so let me keep that sensation. The last time he wanted this, he was feeling bad that I'm going to die. So I need to give him that signal that, so let me keep that, palpitations or anxiety kicking in. But I may not need it because I've still not worked on the thought level. So that's why working on the thought level gives a different understanding about understanding the diseases.
Right. So what I can collect from Jana is mind is there in the brain. It's also outside possibly. And of course, to have a healthy body, the ambience, the kind of energies we stay is also has to be healthy. Now, Dr. Thomas Lodi is a integrated, is a cancer specialist. He has decades of experience in solving unsolvable conditions, so as to call. Now, I am sure, as I heard Dr. Lodi on some of his videos, he says most of the time people come to him in stage 4 or at last stage, and he's still able to turn around these guys and make them healthy. I'm sure then Dr. Lodi has been largely working, apart from the physical health, he's also working on the mental health or the energy health. So Dr. Lodi, what is your take on this? And how do you help your patients?
Oh, good. Well, thank you. Thank you for the question. I'm glad I joined you right at the perfect time. I mean, we're right at the place where it all happens. Everyone knows of Sigmund Freud. He came up with the idea of the id, the ego, and the superego. And then I think transactional analysis started to call it the parent, the adult, and the child. And they've had different names to come up with to try to describe the mind. I kind of like, I think I prefer the Eastern way of looking at it. I read a lot of Swami Shivananda's work on the mind, and I think that was a little more accurate than the Western thinking. But in any case, the reason I brought that up is because we separate, he attempted to separate mind, body, the ego, the superego, and the ego, as if they were distinct things. And it's just like, and our problem, I think, is using our language. Perhaps Hindi would be easier, or Tamil or Sanskrit would be easier to describe it, but in English, it's very bad. Our language lies. So we can't speak the truth. just because of our language, because our language, we always, everything we say implies that we're doing it. For example, like right now, am I beating my heart? No, my heart's beating. Am I digesting my food? No, my food is digesting. Am I thinking my thoughts? No, my thoughts are happening. So what I wanted to say what I'm saying is that the mind, the body, and the spirit, we've separated it so that we can describe it and talk about it. But I think they're so interwoven and interconnected, and that every cell has mind and every cell has spirit and all that. And in fact, we even in the very strict medical doctors who think that the universe came about by chance, randomly. There was a big bang, and then everything randomly fell into order. Okay, so for those guys, they're the way they look at the way the mind and the brain works, it's not the way we do. Exactly what Dr. Reddy was saying before, how the mind and the brain interact. And they interact, as far as I can see, through the hypothalamus. The hypothalamus then controls the endocrine system, and then it goes down to the lower hindbrain, and then you've got, the what do you call it? What's the long
spinal cord?
Which one?
Biggest toe.
The vagus, yeah, the vagus nerve, and then that receives. But what we're finding out now is that 90% of our serotonin is in our gut, and mostly by microorganisms, right? And so there are like I think 1.5 quadrillion microorganisms living in and on us, and there's only about 100 trillion of our cells. So I don't know why we call them, because without them, there's no us. So really, I think they're part of who we are, right? And so I think when we come to this, when we try to understand who we are, we have to kind of broaden that concept of who we are. But anyway, the hard, cold scientists are saying, well, now we're not sure if the mind is actually located in the prefrontal cortex. We're not quite sure, because we think it's also part of the midbrain and the hindbrain. And then now they're saying, well, yeah, but it's also in the gut. And so the mind, the question is, it's very interesting. So if you talk to an American, and an American is referring to himself, an American will point to his head. If you speak to a Japanese person and they're referring to themselves, they point to their heart. Watashi wa tini. So this is where they emanate from. Well, we're us Westerners, we're way up here in our brain. We think we're our thoughts. So anyway, so and then when you get down to it, what is matter? What is physicality? Physicality is energy. And so our distinctions between all of these things are very difficult to I think it's incomprehensible. I don't think we can understand it, because we're using the very thing that it's made of, right? It's like that saying that we say, my eye cannot see itself, my finger cannot touch itself, right? I mean, so in other words, yeah, we're too close to really understand it.
That's a very interesting thought that you started. The mind is everywhere, and we all our energies has manifested into physicality, right? Yes. So I think Deepa can take this forward and put your thoughts onto it, how energy is affecting us.
Okay, so first of all, I think that I've been in yoga for over 2 decades and in functional medicine for over 5, but I'll truly say the greatest teacher was my own son, who was born 12 years ago. And we've all spoken a lot today about cortisol. He was born without the ability to produce cortisol and aldosterone. So he's a steroid dependent child, and that really made me dive deep. I had no clue what was the adrenal gland when he was born. And then I got into understanding how it regulates practically everything, our blood sugar, our blood pressure. So my intersection has always been between ancient wisdom and functional medicine, trying to bring the science. But I think we have a rich source of knowledge in our country, and while I have great respect for evidence-based and research, I really think that can be, again, a trap that we can fall into at times. One, because we cannot always wait for research to catch up on ancient tools and energy. I mean, it's 20 years later after I started teaching yoga that now research is coming out that meditation thickens the corpus callosum. It improves the communication between the right brain and the left brain. So if we were to keep waiting for research to help us to find this intersection, we are going to lose a lot, which we can use to actually support a lot of people. So that is something which is really pertinent here. And Dr. Vivek made a beautiful point about how mental health is an area that we really need to respect, that, you know, we shouldn't allow our ego to come into our practice, because it is a critical area. The truth is, globally, suicide is growing at a very alarming rate. However, in one area, I would probably differ a little bit from Dr. Vivek, no offense to him at all, but just because I've been seeing so many patients in the last 5 years who have been on antidepressants for as long as that. And the injustice and the missing link there, Dr. Vivek, and this is just me sharing as well to you, is that I have reached out a lot of times to the consulting psychiatrist or the psychologist, and I've always been met with a wall of resistance. And I think there's so much missing there. You can't have, let's take a classic example of a client who came. She was put on an SSRI or an antidepressant in the 1 year after she had a baby. Now, typically postpartum, progesterone's dropping down very fast, so is estrogen, and that's a phase where women just become estrogen dominant. That is an acute time. I mean, she couldn't cope with taking care of her child. She couldn't function. So I would very much agree that the antidepressants saved her life at that point in time. But to keep someone like that for the next 10 years on an antidepressant without going into all the other areas that are triggering that sort of a situation, that is an injustice. And I don't think any of us as practitioners, be it functional space, be it the conventional space, should allow our ego to stop, because that's an injustice to the patient itself. And if I had a little bit of time, I would go into where's that missing link, because I truly believe that more than psychology following physiology, it's the physiology that's driving psychology. And we have to absolutely look at that physiology within, because, and it's a beautiful thing that I want to share. Just yesterday, a client of mine told me that, you know, I'm doing all your meditations, I'm doing your husband's meditation, and nothing is helping me to feel any better. And it was as simple of giving him a detoxification yesterday. I said, okay, cut the call, go back and just clear out your bowels. And then he sent me a message the next morning that overwhelm and that gloom of doom that was sitting on my head just disappeared.
All right. Thank you. I think that is an interesting note that you ended with. I think we are all we are as panelists here or our audience, we are all with a very, very open mind. Doesn't matter any degrees or whatever we know, but we are with this open mind that we can learn something. At the end of the day, we can help our own patients and our own self and our society, so that we can. And I think because of this openness, we are all here. So I really appreciate, and I think nobody would mind. But yes, I think you have brought in interesting concept. Just like a computer, it has to has a good CPU to receive the Wi-Fi, right? So to have a good body, healthy body, to have good thoughts generated, to receive good frequencies also, we need to have a physical brain in a good shape also. For that also we have to work. So Marcin, what are your thoughts? A lot of people we find today with a lot of toxic elements, aluminium, mercury, arsenic, lead, cadmium, strontium, a lot of things, and you are into the testing. What are your clients or your clinicians tell you after they have detoxified their body from the elements? What is your information on that?
Hello one more time. So Dr. Lodi inspired me to change the sentence. I guess we all know that we are what we eat. I think that we can say today, we think what we eat, or even further, our thoughts are what we eat. Because everything, you know, beginning at the smallest part as a mineral. So with that down, our body is affected by toxic minerals, and our brain is affected by the toxic minerals in two different ways. You know, the first one is directly, and the second one is indirectly by weakening the work of other internal organs. Why? Because toxic minerals can replace the good ones, like, you know, zinc, magnesium, sodium, at enzyme receptors. This exchange causes enzymatic chaos, which will decrease our enzymatic activity. What does it mean in practice? In practice, this means decreasing of the condition of organs, glands, and entire system. And consequently, our predisposition to bacterial, viral, and fungal infections increases proportionally. Heavy metals pose a serious threat to health and life, and easily cross the placenta, what is very important in pregnancy, and the blood-brain barrier. And here I'm thinking about the direct impact of heavy metals in our brain, because it is really serious problem. And so they can cause acute and chronic poisoning. They primarily cause changes in protein synthesis and disturbance in ATP production, which result in serious pathological changes, including cancer, what we are talking about. And here the one group is in big dangerous. There are children. Children are particularly at risk group in whom many defense mechanisms are not yet active because the immune system itself is only just beginning to form. Right. So yeah, according to the literature, heavy metal toxicity may be one of the main causes of childhood behavioral disorders. That's why it is so important to use, for example, the EHA test in working with children, especially those suffering from ADHD, autism, and other disorders.
Right. Thank you, Marcin. Thank you so much for these thoughts. Now, it is interesting. I don't know whether energetically we are in a better situation or a bad situation, but definitely environmentally we are in a very, very poor situation. There's bad water, bad air, bad lighting, bad food, lot of radiation. And Thomas Lodi is a proponent of saying that, we can stop making of disease in the body as long as we keep the sync with the nature. If we don't keep the sync, the disease will come, and there's no such thing called cure. We can only keep health. So Dr. Lodi, in your experience, the disease is rising, and 80% of the body is water. And if we have to make something change, water is a crucial component here. So today we are drinking RO water, which is unstructured, which is chlorinated water. We are taking a bath with lot of radiation around us. There's a lot of blue light, LED light, computer light, all the bad lighting around. We hardly get the sun. So what is your take on it? How critically important the light and the water, before food, you think that is critically important? Before we fix the food, we have to fix the water and the light.
Well, yeah, I mean, it's interesting. If you look at the Judeo-Christian Islamic scripture, right? The first thing that came out of God's mouth was "Let there be light," right? And the next thing was water. He separated the firmament and the water, right? So these are pretty important. And if we're looking for life on another planet, we're looking for water. We got to find water. Water is the great electron acceptor, and then So anyway, it's redox. We all know that redox biochemistry is how I think it's how the spirit involves into matter. It's how consciousness is able. It's how life is able to exist is through redox biochemistry. It's very interesting. what I wanted to say real quickly, I just wanted to comment on a previous discussion that was out was when we talk about antidepressants, and most of them are serotonin reuptake inhibitors. So we're trying to keep more serotonin in there. Well, if we already know that 90% of our serotonin is made in our gut, then let's work on our gut. And if we know that most of them are it's our microbiota that does it, then let's fix that. And how do we fix that? We don't. That's the thing I'd like to make clear, is that the best thing you can do to improve your microbiome is to eat right. Because if I eat fast food, then I will attract microorganisms that like fast food. If I'm eating, horse food, I'll attract the microorganisms that like horse food. So anyway, it's kind of the way it is. So really, it always comes down to that. But how important is water? It's the one thing I do with all of my patients when they come in. The first thing I do is I load them up with saline, normal saline. I check the orthostatic vital signs. I make sure they need it, but most people need it. I find that the world is pretty much dehydrated. There's a very interesting phenomenon that occurs to all of us somewhere between the ages of 18 and 23. Something happens where we no longer know that we're thirsty and we think we're hungry, and we wind up eating. Every time we're thirsty, we wind up eating. And the truth is, if we really just drank some, water, or even a nice young coconut or something, we'd be satisfied. So we get stuck in that, and I think that begins our downward trail into dehydration. But it's severe. I've had people come in the emergency room who I was told that, well, they've been this way for weeks. It was an older person. They've been this way for weeks, and I really think that it's Alzheimer's, or whatever. You give them a couple liters of water, and they're back to normal. So water is very, very important, and that's the only one thing when I talk to people about fasting, because I have led thousands of fasts. In fact, I've had advanced stage cancers do 42-day water fasts.
Fantastic.
And actually, and it's gone. The cancer's gone. What was I going to say? But the other thing I wanted to bring up, just because I think it's pertinent to this group. You're an amazing group. Thank you for having me. But I now see cancer, the tumors, as the fruit on the tree, and the roots of that tree are psychospiritual. So, for example, not every one of the patients that have left-sided breast cancer have problems with their mothers, but most of them do. And not every woman with right-sided breast cancer has problems with either her husband or her occupation, but most of them do. So there's a psychospiritual connection with the manifestation on the physical plane. And I thought that was very important. But anyway, I'm not sure I answered your question about.
No, I think it's a great conjecture you have made. Past is also manifesting into the present. I think this is where Janna can really shed more light. He is also a past life regression therapist. So I think you connected the dots. Janna, please.
See, like I say, irrespective of whether it's a past life experience, is a current life experience, or we genetically pick it up from our ancestors, because I especially work on constellations with diseases. Basically, like cancer. I work on rheumatic heart diseases. To understand how this is manifesting into different generations. Of course, this becomes a little subjective, because sometimes 3 generations or 4 generations behind, we have no validation whether really that particular ancestor had a disease as such. Like how it happens is everything happens at the thought level. Like we talk about it. I'm attending to a cancer patient here in Dubai. Already surgically removed, breast has been removed, but we are understanding that why that particular emotion that's kicking in. Right now, she's got a severe craving for sweets. Surgery over, 1 year, treatment is going brilliantly, everything is working fine. But somewhere there is a missing link. What is the missing link is the thought. She from her childhood has not been nurtured. Okay, there is always a dysfunctional family, the nurturance is not there. So she is not connected to the mother, energy of the mother. Then why the craving? She is replacing that with the sugar. Even though she knows Sugar is very dangerous for her current condition because she's been recovering from this, but an immense, craving that goes and hits upon it. Now we have gone up to the level of the age of 3 and we regressed it, what exactly happened. There's a mother not being there for a long time, she was sick, and there is a lot of, disconnect that is happening. Now this has got a theme, of thoughts that are coming in, and I'm alone. And that manifests in sort of an emotion. Then the finally body is manifested, I don't have anyone to nurture myself. And then nurture is finally as, of course there are other things that are causing that, cancer cells to start growing up, but we could see finally talk to that. And that at thought level, we are now working on the thought level with number of sessions with her to get a resolution, not just at the body level, also at the thought and the emotional level also. It's very important, especially when you want to manage diseases. It's very important to understand, what is the origin of it. It's very important, where does it start from? How do we inherit all these things, We always call it, it's called sort of an inherited trauma that we carry within our thought system, and then we manifest into a physiological symptom or a body sensation or a body discomfort as such. It can be from any space. From past life, could be the childhood experiences, could be from collective consciousness. We all have been, going by, everything that's happening around us all the while. We call it as socio-economic, environment, and religious beliefs and sentiment that we have. So we might pick up these, thoughts, and then we keep manifesting in the body. Body is a carrier of everything that we want to junk it, like it's junk. You throw everything, it keeps taking it out. When it cannot handle it, then it puts you back. Okay, now I'm having an intense pain, now you attend to it. And that's the challenge that comes in. How do we sort it out as such?
Fantastic. I think it's a good, we cannot just say in functional medicine that food is giving us the problem. It's also the bad thoughts, the junk thoughts, which can lead to the manifestation of the problem. So Deepa, you have any thoughts on how thoughts can manifest as a problem or disease?
Yes, absolutely. I think this you can go back to especially Eastern wisdom, traditional Chinese medicine, and I'm always using emotions to guide which are the vulnerable systems in the body, and you can see it a lot. If you take Ayurveda itself, anything to do with anxiety and is related to Vata aggravation. If you take depression, it looks as Kapha aggravations. And if you look at something like uncontrollable anger, issues with anger management, then it's Pitta aggravation. But you can use these as guidance as to the vulnerable systems in the person's body. And then, of course, you do need to correlate the two. I don't think you should just let that go and say, okay, this person is anxious, they're having issues. Now, if you take Vata, what is Vata telling us in functional medicine? It's telling us that there's a dysfunction in the nervous system, probably the autonomic nervous system. It's a sympathetic dominant state where the person is unable to wind down. If you take Kapha aggravation, what does that mean? Functional medicine, a congested lymphatic system and a glymphatic system. Today, there's research coming out about the glymph system. There's so much research being done on the glymphatic system. This has been told about hundreds of years ago in Ayurvedic texts, which is why you have Nasyam, which is why you have Shirodhara. These are all aimed at releasing the glymph congestion. And then if you take Pitta, then we are talking about what in functional medicine today we are referring to as MTHFR or methylation issues, liver detoxification challenges. So this correlation has to be made where, yes, you use the Ayurvedic and Eastern wisdom as cues as how is the person looking. If someone walks into the room, you can tell, are they having Kapha issues, Vata issues, Pitta issues. But then you need to also correlate that with the science by using your intuition to guide you. But do look into the systems, do look at the serum labs, which can indicate whether there's issues with adrenal function, whether there's issues with liver function. And you can't also take just one one marker. For example, if you take a liver, you don't just look at SGPT, SGOT, GGT, you also correlate it with homocysteine, you correlate it with how's protein being absorbed, how's gut health overall. Everything is so interconnected. And what functional medicine today is talking about, the interconnection of system and root cause, is actually the core of Ayurveda. So if we can find a way to bring the two together in ways that I think the missing link in Ayurveda in India today is that there's heavy reliance on Ayurvedic medication, which is not a path that we really want. That should be used for acute care, not for chronic care. And the second thing is, I think Ayurveds today have moved far away from understanding the diet, the nutritional aspect, and the personalization of diet that's required for a person when Vata is aggravated, when Pitta is aggravated, when Kapha is aggravated. And we've moved away from that. So today, if you go to an Ayurvedic center for treatment, they're going to serve you gluten. They're going to serve you paneer, chapatis, nothing to do with an anti-inflammatory diet.
Yeah, so Deepa, it seems like, path for a functional medicine practitioner is quite tough. We just have to keep learning, and, keep learning and keep implementing, and a lot of things. So now one purpose of this conference was there are a lot of practitioners here. So I want, each one of the panelists to give them some takeaways, how they can put those takeaways into their practice, improve their patient's health or their own health as an enthusiastic. So Jana, first you can talk about, we talked this from the morning, we talked about a lot of detoxification, heavy metal detoxification or liver detoxification. So how energy healing, how sound healing, or anything that you can suggest to a practitioner what they can do to improve their own health or their client's health. So those takeaways, please.
Yeah. So coming to the frequency of the sound, then we talk about sound as an energy medicine. And if you look at what Nikola talked about, Nikola Tesla, he said sound is the future medicine that we are going to think about it. Not just the sound, the vibration that we have. Now, there has been a lot of work going on with respect to sound healing as a medicine, because earlier to it, I used to have a BioWell GDV camera, which I used to do a lot of scan of the reports. I used to technically take out the report before and after the sessions, because then I could watch out after doing a session for about 25, 30 minutes, we could see a lot of psychological changes other than the etheric form of healing the chakras and the aura and things like that. We could see, because the bio-GDV camera is to give about close to about 28, 29 pages of report, which is non-intrusive, and just is to scan the energy and tell us where there is an improvement in the structure or the organic, the body as such. It could be an eye issue, it could be a heart problem. We could be, it could be even in the heart levels, what changes have happened as such. So if you look at, other than, if you look at other forms of healing, like talking about pranic healing, Reiki, crystals are the first dimensional consciousness, because there is already some amount of crystalline structure within us. Crystals will help you to definitely to realign some of the energies. But if you scan with the bio-GDV camera, so there is a lot of evidences that can be found to make use of the sound as a medicine, binaural beats as a medicine, to re-engineer our you can talk to the body, you can work on the body level and start you doing your own self-healing, because there is nobody other than you who can understand your system better than anyone else. You are the creator of your system, because you are the creator of your thought, you are the creator of your emotions, and in turn you're creating your own body sensation, psychosomatic disease and discomforts, and you're also creating your own behavior. And who can change this behavior other than you or me? And there's a beautiful way, the sound that we have seen it, fantastic results with the sound healing, with the singing balls or the gongs or the crystal balls or the tuning folks. We get amazing results with these elements, actually, if you look at it, because they are non-intrusive. You are not trying to change any structural thing. You're not infusing the gut with anything new. You're not trying to do it. Why? And the big question comes, how sound travels in the body, because we all know that 78% of the body is fluids, water, nothing else. And that's why the sound frequencies travel 1500 times more powerful than the normal waves. And what does they do? They basically align the meridian points or the nadi that we talk about. It just align the energy with the glands and the endocrine system. We talk about chakras are nothing but endocrine, various gland systems that are controlling your entire physiology, thought level and emotion level too. And amazing result with the sound healing, and if people can start practicing it and use this as a knowledge, as understanding about it, they'll get amazing results. You don't require a support system that you need to go and do everything on your own outside. You can start practicing it and bringing that elements back into you.
Fantastic, Janardhan. Thank you so much. I think this is one thing, at least we in functional medicine keep saying to our patients, that nobody can heal you. You are only one. Your body and your thoughts has to heal yourself. We as a practitioner, we can make a protocol, we can do a treatment, but if you are not ready, things will not happen. So I think this is a great thought. We all has to work on ourselves. So Sajeev Nair sir, you are an expert into thought re-engineering. So what are the basics? What if I have to work with my patient? How do I help them re-engineer their thoughts? What are the takeaways for me?
I think I would rather quote from Dr. Deepa, what she said. We too much we focus on the mind, psychology, and all those factors. And I strongly believe, and I have from my own life and also the kind of lives I have dealt with, I have seen that the major change, because I also in the good old times, when I used to be in the motivational space and transformation space, I also believed more, I focus more on the mind power kind of stuff. Later on, I realized that, change your physiology, change your psychology. This is a very, very profound thing, what people should understand. Because many people think that I am down, I am depressed, I am not good, I am angry, I am frustrated. It's all kind of mental states, what you're talking about. These are all kinds of connected things which are psychologically, they want a solution psychologically. And most of the time, it may not be possible, even just like what from the morning, there has been a lot of, focus on the gut health. So if you don't have the right kind of microbiome, just like Dr. Thomas said, how in the world do you think that you are going to produce enough serotonin or dopamine? And as long as you don't have it, how much ever motivation you can get from a psychologist or a counselor, it is not going to stay there. So you need to get your gut right. You need to connect with the earth, because one of the biohacking techniques, because I'm a strong propagator of biohacking. So one of the strongest biohacking techniques, which we all think, the moment people think about biohacking, they always think about the kind of inserts, what they are doing in the Western world. But I strongly believe that India has got the greatest biohacking techniques, which are all connected to the ancient wisdom. Now, if you look at, there is a practice in the West, they call it as earthing. Now, what exactly earthing is? Nothing but, walking on soil barefooted. And interestingly, when I ask this question to people, they are actually getting sad. I said, when was the last time your feet, your body touched soil, your body touched Mother Earth? I in my home, I am walking, without any chappals, but that is on a ceramic or a vitrified tiles, not on the actual soil. At least once in a week, can you go out and on barefooted? Can you walk for 10 minutes? This can make a big difference. I personally have seen some experience. I experienced something in my life, and when I was feeling I've experienced, I have shared that experience. The pins and needles at one point of time, I resolved that issue only through earthing. So, and another thing, what I wanted to give it as a takeaway is that one is that stay connected with the nature, just like what Dr. Thomas said. Conscious of what you eat, very, very important, because your physiology is going to decide your psychology. 3, I strongly believe that you should be observing your body. I think your body has got a lot to tell you. We just ignore that fact. We don't listen to our body. In fact, if you keep on observing your body, I can tell you that most of the things can be fixed. That is one of the best biohacking, something can be applied. And 4th is you have to understand that your emotions are also connected with your emotions. It is not just emotions, means you're down, means you're sitting somewhere and you're going to be more down there. So you move your body. This is very, very crucial. Move your body, whether it is yoga, exercise, whatever you like to do, move your body. It's the most critical part, because human beings, I believe, is being given this kind of a body to move it. It is not to sit in one place. The most challenging task what we are right now having is that to move our body. So the more you can move your body, because now, right now, I was thinking that, I have another session now happening from 7 o'clock. So I think, between that, I need to go for about 10 to 15 minutes and walk on the ground, because this is something which we have to consider it as a priority. I think life can be, you can see life from a completely different perspective.
Right, sir. So I think we all are born with that intelligence to keep a healthy body, as long as we do the needful that is set by the nature, or the rules set by the nature. So Dr. Thomas, you are expert on mitochondrial health, also metabolic health also. So what are some of the takeaways of the basics, like Dr. Nair has told about grounding? So what, in your opinion, what are the basic things that for a metabolic health we all should do for our clients?
Okay. First of all, I think one of the things really important that we need to do is get rid of the word disease, because this is a myth. And actually, when I got my MD degree, I realized that it stands for Doctor of Mythology. So now I'm really good. I know all the mythologies called pathology. I've read all those textbooks, right? And we're talking about pathology and diseases as if they are third-party entities that get into us. So like my diabetes, where is it? Where's my hypertension? So these are not things. We must understand and regain a respect for God, a respect for nature, and understand that everything our body is doing is an adaptation to a situation that is not meeting, it either is meeting our biological requirements or is not meeting our biological requirements and our psychological requirements and all of that. So the adaptations that our body goes through, we are calling diseases that must be eliminated. We don't want to eliminate them. I mean, if I had to walk with a cane, what are you going to do? Kick the cane away? Or are you going to teach me how to walk? Teach me how to walk. Don't just kick my cane away, right? Okay. So, but anyway, the reason that our body has to adapt is because we think the great illusion, the fundamental illusion of humanity, which is why we are today where we are, is that we don't think we're part of nature. I don't know what we think we're part of, because nature is everything. But anyway, we don't think we're part of nature, and we have the great philosophers of the 19th century, man versus nature, and all that stuff. And science is going to subdue nature. We are nature. It's like my baby finger arguing with the rest of my hand. So anyway, we are nature. And so all of our conditions of ill health are a consequence of our deviations from living in a life that would satisfy our biological requirements. So that's all you do. Take your shoes off, walk on the earth. Absolutely. Do this. Go to sleep at 8 p.m., 7 p.m., because we are diurnal. And if you study sleep, you'll find out that going to bed at 11 p.m. and waking up at 7, you didn't do it. You got a lot of REM, a lot of good dreams, but you didn't get a lot of good restorative sleep. So we were meant to go to sleep at that time. So go to sleep early, and when you wake up, meditate, read, and then do some movement. And then regarding movement, I loved what you said, Dr. Nair, because I have on my team a kinesiologist, and what we teach our patients is this: if we were living in a natural world 10,000 years ago, before machines, right? From the moment we woke up, we would be bending and moving and lifting and twisting, and we'd be doing that. We wouldn't sit for 3 hours and then work out for an hour and then sit. I mean, working out in the gym is just as unnatural as sitting at a desk for 3 hours. So what we do is the kinesiologist, he looks at them, he works with their physiology, and we give them different exercises that are 12 minutes long. And every 90 minutes, they set their alarm clock at their desk. And every 90 minutes, they get up and go do something. And if they can, they go outside and take your shoes off. That's why I live in Thailand. I live in Thailand, and I live on an island so that I don't have to wear shoes. And I don't have to wear long pants. And I can get out, I can reconnect. So my message is to restore health, we have to meet our biological, psychological, and spiritual needs. And to do that, we need to reconnect with our mother. Our mother is the earth. You know, our father is spirit. So the Immaculate Conception is spirit immaculately sown into the womb of matter. And that's who we are. So we're all the Immaculate Conception.
Right, sir. I think this summarizes the whole conference also. If we have to manage the disease, it's a far complex, we can get to a cellular level, we can talk about a lot of difficult things, but if we have to manage the health, it's good light, good water, good food, connection to the Mother Earth, sleeping at time, basics that can help us contain our health. So now we can open up for the audience. If anybody has a question, Ruhi, you can help us take me the question.
Yes, we do have a question here. How do we prove in a scientific way that, our thoughts influence the structure of the water, or, or our energies? It's open to the panelists.
Well, you know what? Can I just say one thing about Dr. Emoto? You all know about Dr. Emoto, right? And that goes back to prayer. It goes back to intention, right? So when they they looked at the holy water blessed during the Holy Week in Rome, and they looked at that water versus it was taken out of the tap, and it was completely different. So good intentions, prayer, and things like that. If you're suppose you're poor, you're very poor, and you can't buy bottled water. You can't buy reverse osmosis. You can't do those things. What do? And that's what I would say is do some prayers, make the water special, make it sacred. Anyway, that's what I would say about water. And the best water that I like is I like to juice vegetables. And if I juice, because the plants take water and they turn it into something that is full of life for us. It's amazing. So that's another good thing to do if you can't buy bottled water. Juice, make vegetables.
Right, sir. Thank you so much. So just to answer that question, so we have a friend, they are in US, they have a company called Leela Quantum Tech. So they have this quantum energized bottles. So Emito Institute in Japan is they are the experts on the water. So when they have looked the water from a regular water bottle and that quantum energized charged water, they could see the stars. I think regular water has only 4 stars when it shows the structure of the water. And this water, after keeping the water in this special quantum energized water bottle, there was 8 stars. Basically, the structure of the water has improved significantly by keeping it good energy. So there are ways to improve this thing. There are technologies which are proving the case. I mean, of course, like Deepa said, we really need not to prove everything, just to make sure that we have to believe only if it is on the paper. So nature has showed us the way, and there's a past with us. A lot of yogis has done a lot of work on that. So we just has to go with that also. So thank you so much, panelists. I really, really appreciate that you could take up time and be here us and share your thoughts. Sometimes things are very, very simple, but very, very profound. Thank you so much.